Let's speak to medical doctor now, Femi Oyeko. He joins us to discuss the surge of coronavirus cases across European cities. Thanks a lot for joining us at this time, Dr. Oyeko. What do you make of the fact that most parts of Europe have experienced a surge, but Italy appears, to be having not so much a rise as against other parts of the continent?
I want to say thank you for making me part of this conversation. First, I want to let you know that some of the drastic measures Italy have taken, as opposed to other part of Europe, Italy has now made face masks mandatory, and you are supposed to pay a fine if you are found in the public not using a face mask. And there are no rights group, human rights group that are advocating and saying, no, you are infringing on human rights. We're supposed to be free and all of that. So in a way, there is cohesion, and the entire nation is supportive of the government policy. Because if you look at how Italy was hardly hit at the initial outset when COVID struck, you realize that Italy was in Europe the hardest hit nation initially. So this, in a way, in order to prevent a second wave, in order to prevent a second lockdown, there is a national consensus towards effective use of face masks, and then there's effective use of social distancing, and vulnerable age group like the adult, people with comorbidities are now voluntarily staying at home and avoiding any of those crowded places. So this, in a way, have contributed significantly to the changes and positive results we are seeing from Italy.
Let's talk about what the other parts of the continent are missing or not doing right. You talk about cohesion in Italy, but when you monitor what is going on in the UK, where we are seeing political parties, assessing the government in the downside, saying the response hasn't been enough. What is it for you?
Well, in the UK, there are a few lacks in the coronavirus management that has become evident lately. One of it is the fact that results that we tested in people that tested positive test in private hospitals were not added to the national data. That's just new findings right now. So even if you want to do contact tracing, which is an app that was recently generated to help reduce the number of community spread, that in a way will be less effective. Another thing is the fact that the contact tracing, even with those that are tested positive in the government hospitals, the contact tracing has not been effective. So when you add all of this together, you're beginning to see that the management that the UK government is putting in place, it has a lot of administrative loopholes, which is why you're beginning to see this significant rise in numbers again, and people are beginning an imminent national second lockdown is looking very likely.
Right, and
point of view.
Right, and there are obvious lessons that the rest of the world should glean from what we see transpiring, even though you can also say, on the other hand, that testing has, largely improved, prompting the spike in cases. What do you think?
Well, I'll say that no doubt. If you see that the number of people testing positive has increased because of the sensitivity of the cases, but when you look at the other rationale, that's where opposition and political parties are looking at the fact that sometimes I've said this earlier, that when you say pubs or what the so-called beer parlor are going to be kept open until like 10 in the evening, and when somebody is drunk, he doesn't know what using face masks is or what keeping social distances. These are some of the factors that people are beginning to say that there needs to be deliberate acts from the government to see that things are done rightly, even if it's going to require temporarily drastic measures to put the society back on the right track. And when we are sure that we have the vaccine, we have therapeutics, we have credible other solutions that can effectively deal with coronavirus, then we can say, let's go out, it's time to be happy again, and let's feel free. But at the moment, that's not the situation.
Let's quickly wrap up our conversation now, putting a spotlight on Nigeria, for example. So we are seeing a lesser number of infections being recorded, even though the government is still saying Nigerians have become rather lax now in wearing of masks. For you, what is critical in a case like Nigeria?
I'll say that the Nigeria case is slightly peculiar, but I'll say that from the outset, I'll say that in this corona situation, African governments seems to maybe in a way understood the limitations of their capacity, knowing fully well that coronavirus, if it hits Africa the way it hit any part of Europe, the ability to contain or manage the excesses was going to be very difficult. So at the outset, in countries like Nigeria, South Africa, Egypt, there was deliberate, strong effort by the government to ensure that lockdown. But at the moment now, from what I'm hearing from some of my close friends and colleagues back from home, the lockdown seems not to be, people are almost going about their business as if nothing is happening. But let me say something. The difference between, from scientific findings now, the difference between when you have a black person infected with coronavirus here and the black person is vulnerable and almost near to a dead point, as opposed to what we have in Nigeria. Scientists have said that this could possibly be as a result of sunlight, because here in Europe and in America, the rate of exposure of people to sunlight and how the black skin is able to absorb the UV rays, it is not as much as when you have an intense sunlight in Africa, in Nigeria, where sometimes the temperature could go as high as 35, 39. It is not the same thing here, where you have sometimes the temperature could go as far as -1, -2. So sunlight has also played a significant role in keeping Africa on the very moderate side as regards to the intensity of coronavirus. So in a way, nature has favored Africa, and also let's admit that at the outset of this coronavirus, the government in Africa demonstrated credible leadership.
Right. Well, Dr. Femi Oyeko, thank you very much for your contributions. You're in Europe. Winter is coming. Do keep safe.
Thank you.